Yes, COVID-19 has changed a lot of how we function on a daily basis, and undoubtedly it's going to have an impact on Qurbani this year, 1441, in the Islamic calendar. I'm joined now online by Dr. Arshad Meite. He's a PhD graduate in biochemistry at WITS, senior researcher in the Vaccines and Diagnostics Development Program at the Agricultural Research Council, and also part of the Veterinary Research Program. Assalamu alaikum wa rahmatullahi wa barakatuh, Dr. Arshad.
Wa alaikum salam wa rahmatullahi wa barakatuh.
It's wonderful to have you on air. He's also the founder and deputy director of the African Muslim Farmers Association, AMFA, and plays an important role in guiding the public on what to do and how to do during the times of Qurbani. And now we have COVID-19 set upon us. So, Doc, what should we be doing? What changes this year?
With regards to Qurbani, I mean, we all are aware of the situation we are facing with regards to the COVID-19 outbreak and the pandemic. And I think the main thing, when considering Qurbani, where to make Qurbani, is minimizing that risk of infection. We are all very aware of how this virus spreads, how we get sick, etc. And that's the main thing, is look at ways to minimize that risk and what will ensure that we are safe, and that would guide us in the decision of where we want to perform our Qurbani.
Should we be making Qurbani, at the farm, going in large numbers, the entire family, the kids, the wife, everybody packing up, going to the farm, all getting involved in the slaughtering? Should we be bringing our animal home, or should we just be outsourcing and having the various farmers and service providers deliver the produce to the door?
In all these various ways that you've just suggested, Azhar, there's risk associated with them. And like I say, we need to look at each situation individually. Definitely avoid crowds. Definitely. That's your main criteria. I mean, we know that this virus is an aerosol-based virus. I mean, in fact, some scientists are now even thinking or suggesting that besides it's airborne, not only aerosol, which means droplets, but also floating around freely in the air. So the main thing is avoid crowds and avoid close contact with people. So whether it be on the farm setting, make sure that the farm itself has protocols in place. We as AMFA have put together a document which we've circulated to our members. And this document is also freely available. It can be shared with anybody, and it can be used in the home setting as well, with regards to protocols to have in place. Use of PPEs, use of face masks, use of sanitizers, screening questions when customers come into the farm, and then also trying to stagger slaughter. So we've put in some measures into place and then advised farmers on this is how procedures should be followed. And with regards to the home setting, one of the main things to look out on the home setting again is, are you capable of skinning animals? If you are not, you're going to hire external help to do that. And then this help coming in, how certain are you that this person that you're getting is free from COVID-19? What procedures they follow at home? That's another big concern. And then outsourcing, well, outsourcing is probably the safest way to do that, where your risk is minimized. Yeah.
Well, I suppose also in the outsourcing, when people come and deliver to your door, the packaging of that particular animal, or it's in a plastic bag or punnets, even that could contain some trace of the virus. People should just wipe that down before touching them or putting them into their freezers. What do you think that there's a risk there as well?
Yeah, correct, definitely. And again, like you've mentioned, when I mentioned outsourcing, sorry, I meant sending money out to be done, in out of country remotely. But you're right. If you outsource and get that meat delivered to you, again, social distancing, make sure there's at least a meter between you and the person delivering the food package to you. Wipe out the outside of the packaging. You're just using a damp cloth soaked in a 10% solution of bleach, sodium hypochloride, and then make sure you thoroughly cook that meat. So again, we're trying to minimize that risk when you get delivery of that meat to your premises. Yeah.
I see one of the guidelines that have come out is, when once the animal has been slaughtered, then to take the animal, hang it by its hind legs before skinning, and then wait for a period of about 8 minutes. This reduces the risk of contamination by surface contact. How significant is this in the entire slaughtering process?
Well, this is really a critical meat issue with regards to the setting of bleeding out the animal. And this also contact surfaces. Currently, a lot of the indications are that it's not a major mode of transmission of the disease, but we have to be really cautious with regards to surfaces. So, the issue of it's just unhygienic practice anyway, leaving the animal on the floor, dust, dirt, etc., and other contaminations are lying around. So the best practice, definitely, and this is a sort of the practice followed in a lot of abattoirs, professional abattoirs, commercial abattoirs, where the meat is hung up. It's allowed to bleed out before you're getting skinny, and you're avoiding all this, contaminants on the floor surfaces, etc.
One of the items that are used is obviously the knife, right, in the slaughter process. Now, a knife may be shared between people. One guy is skinning, or he may pass on a knife to another person, and that person is using the same knife. So that is an item that is possibly shared in the process. How do we make sure that that knife stays sterilized and clean?
First rule, I think, as best as possible, if in fact, if you're going to the farm as an individual, take your own knife again, so you're minimizing that risk. And but if you happen to share a knife, what we've recommended for some of our farmers is really to make sure that we wash those knives as often as possible. And really, a good practice is having a 20-liter drum of a 10% solution of sodium hypochlorite, which is your bleach, your jik, and during the slaughter, just throw the knife into the solution so it sits in there, allowing it to get sterilized, and then use removing that from the solution before you continue with the slaughter. Use of gloves, a lot of farmers, we've also advised in one of the documents that EMFA has put together, and we've had a collaboration with SEMNET, South African Muslim Network, and we've also put together with IMASA, the Islamic Medical Association, giving some guidelines to the community and to our farmers, and using of gloves is also a good practice. If you can afford that, if it's possible, you give gloves to each slaughterer and change them as frequently as possible. And then hand washing, again, a good practicing of hand washing. Make hand washing facilities available at the farm, at your home. Have liquid soap available. And between slaughtering, make sure you wash your hands and wash the knife. If you don't have something to soak your knife into, just make sure you rinse and wash it as often as possible. And this will then minimize that risk.
Dr. Arshad, is there any final comments that you'd like to make, perhaps add in terms of assisting people and providing some guideline for a safe Qurbani 1441?
Again, the main concern with us is avoid large gatherings, as best as possible. If we are getting together with close immediate family, try to maintain that social distancing, wear masks. The elderly, keep the elderly away from large crowds, people above the age of 55, 60 years of age, those with comorbidities, those who have underlying medical conditions. Make sure they don't go onto if you choose to go on the farm setting, make sure you don't take such people with you. Make sure you don't take children to the farm setting. And as best as possible, if you opt to do a slaughter on the farm, best to nominate one youth from the family, a young, fit person, who will go and make your Qurbani for you and bring your meat to you, and that's some of the things to look out for. What we also suggest is, before you use any facility, inquire, always ask questions, ask questions to the farmer that you are going to, ask questions to the person dropping off your meat, are you following good practices with regards to COVID? Are you using masks? Avoid sick people and interacting with sick people. And this would then, inshallah, minimize that risk for us Muslims during this COVID period.
Dr. Arshad Mehta, the founder and deputy director of the Africa Muslim Farmers Association, senior researcher at the Vaccines and Diagnostic Development Program at the Agricultural and Research Council. Jazakallah khairan for your time this morning and for sharing that important information with us. You go well. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam. Jazakallah for having me on your station.